Gum disease is treated a couple of different ways. One is we come into the office and our hygienists are removing that bacteria and their byproducts away from the teeth. If it has not caused further damage, then that's generally what needs to be done, and you need to come in on a more consistent basis so that doesn't happen again. Gum disease is a crummy disease. It nickels and dimes you. In other words, you lose a little bit of gum and bone around the tooth. Then you get everything cleaned up. You don't go to the dentist for a long time. You lose a little bit more. And then you have people who've been doing a great job, but they moved or something has changed in their lives. The bacteria doesn't care you did a great job for 20 years. It's looking right now, and it starts taking away gum and bone if you miss. That's why it's unfair. You don't get any credit for doing well. You just get to keep the bone and gum at the same level. You just get taken away. So you never want to lose the gum and bone because it's irreversibly lost. It's something you never get back. So you want to be on top of your gums to make sure that you have the bone, else your teeth will serve you your entire life.